Welcome everybody. My name is Ayan Mahmoud. I am the Policy and Advocacy Manager for Save the Children, and I will be your moderator for this discussion on the impact of COVID-19 on children's rights, hosted by Save the Children Somaliland, Somaliland, Source Children's Village International Somalia, and also Plan International Somalia and Somaliland. I will repeat again for the purpose of the meeting, and I would kindly request you to unmute yourself again. I know that can be frustrating, but I think that would be for the best of having the best experience from the meeting so you're able to hear. And also please put all your questions and comments in the chat box, and our panelists and experts will be able to cover them as much as we can. I would like to let you also know that this call will be 40 minutes and it will be a recorded call. Our esteemed panelists will have maximum 7 minutes to present their presentation, and also at the end we will have them 5 minutes each for them to answer our questions and also give us recommendations and takeaways. So before we start the discussion with our panelists, I would like to give you a bit of a background. I hope everybody is able to hear me very well. If you are unable to hear me at any minute, please put that in the chat box and I will try to answer that. Try to fix my mic or the camera. And I will also, okay, apology. So I'll try a bit of a background of why we're doing this now. You all know that the spread of coronavirus in Somalia and Somaliland continue to devastate thousands of families. As of today, we know that across Somalia and Somaliland, the number of cases that has been recorded are 2,618 cases of a coronavirus with a death of 88 people. We all know this, and this is not just a health crisis, but it's also social and economic crisis for Somalia and Somaliland. It is true for our context, we are still struggling to build our system to address the most urgent needs of our population. This crisis, like any other humanitarian crisis in Somalia and Somaliland, always has a bigger impact with the children. We all know that the children had been out of school for more than 3 to 4 months now. I'm sure you all heard that the number of cases of child rights violations have increased, especially gender-based violence, FGM, child marriage, and gender-based violence in general, focusing more on rape. As a child rights organization like Save the Children, Source Children's Village International, and Plan International, we all know that this has a lasting impact on children and their families that we work with. And we are trying to find ways which we can work together as a child-focused organizations to minimize the social and psychological impact of COVID-19 on children. So for us to address this, we Save the Children has created this platform to provide opportunity for key stakeholders to come together, like our colleagues from Plan International, SOS, Source Children's Village, other key civil society organizations to explore policy and programmatic solutions to minimize the impact of COVID-19 on children. And I think that's really, really important. As a child-focused organizations, we come together to make sure that children are visible. So this will not be the only webinar or the dialogue that we will organize. So every other week or every 2 weeks, we will be inviting child rights experts, researchers, activists, and policymakers, and children themselves to elaborate more on the most urgent issues and agree what needs to be done for the children. Our aim is no other than to bring the public attention to the urgent pressing needs for children in Somalia and Somaliland. That's why we made this an open forum for everybody to to attend and listen from our experts, listen from the child organizations, uh, sharing interesting findings in different reports and evidence that we have gathered. So for public to know what children, how COVID-19 has impacted the children of Somalia and Somaliland. We also this to serve as a platform to ask the governments in Somalia and also in Somaliland to put concrete measures in place that protects the children during this pandemic, and also ensure children are at the center of state and national efforts to combat COVID-19. I hope this clarifies why we have organized this dialogue. We will definitely assess and debate on the impact of COVID-19 on children, and we will also give you an opportunity to ask the questions and concerns that you have. And I hope we'll be able to answer it from our panelists and also from the attendants as well. We also want to discuss how can we advance the system of a dialogue between the children and the policymakers. We know in Somali context, our children have a minimum say on what impact, how can they say issues that affects their lives. So we want to give the children a platform so they can share with us how they feel with this pandemic, how is it affecting their lives. I hope everyone is able to hear me well. And also we will discuss how can we together as a public and also child focused organizations, how can we put this as a priority for the state, for the government, to put the child rights agenda at the center of COVID-19 response. However, for us to have, for us to understand more, we are bringing on board 3 experts who will be sharing with us these key issues that we want to discuss. We will hear from, we will hear more about children's rights at risk. And we will look at the bigger picture of how COVID-19 impacts children at general, both in Somalia and Somaliland. On this, we will have our expert in child protection, our Save the Children child protection and child rights governance specialist, Mohammed Aqli. Aqli has experience working within the child protection over a decade. He worked with different civil society organizations, youth groups. He's specialized in child protection emergency and community mobilization, and also he has an extensive experience in peace building and conflict. And then we will have, I want to be able to go through all the biography of my honorable panelists, but I'll try my best to cover them as the time is really running. We will also hear from Sylvia. Sylvia, she will speak about the impact of COVID-19 on women and girls specifically. Sylvia is a child protection emergency specialist with Plan International Global. She was in Somalia and Somaliland for the last few months to support the new office that's been opened in Somaliland. She's currently based in Spain. Due to the coronavirus, I think the deployment will not be possible. Sylvia has worked in different countries across Africa and Latin America, focusing on refugee response and crisis, especially European refugee and migration response, and also child protection in general. Sylvia has also been Save the Children staff before, so we are glad to have our former colleague on board. Sylvia has a bachelor degree in social and cultural anthropology, and also bachelor degree in journalism and masters in humanitarian action from University College in Dublin. Lastly, we will hear from Abdulkader Daqane. He's a director of Source Children's Village International in Somalia. Daqane has worked with World Vision in Syria, and also he used to be Save the Children colleague as well in Iraq and also in Somalia as child protection program manager and also child protection subcluster coordinator. He worked in Somalia, Ethiopia, Syria, and Iraq and Turkey. And we have a lot of people who have decades of experience working on child protection. Finally, we will also hear from our children themselves who are affected by this virus to share with us how COVID-19 has impacted their lives. We will have three children joining us from Mogadishu. Selma Abdurrazaq Salat, she's 17 years old. Mahmoud Alanur, who is 18 years old, and Hawalul, who is 13 years old, speaking to us and how they feel in these difficult times and share the voices of the other children across the country. Before we start the discussion, I would like to welcome Muhammad Aqli from Save the Children to speak to us about how this coronavirus has impacted the children of Somalia and the overall situation of the children. So it's my pleasure to welcome you. Welcome Aqli on board.
Thank you very much, Ayan. I would like first to thank the organizers, particularly Save the Children Advocacy Communication and Campaign Management team, who have been organizing and make possible this webinar. I would also like to thank also the panelists who have paid their effort to also prepare and share their experience. I would also like to thank the audience for their participation. I will briefly talk about the overview of the impact of COVID-19 on Somali children. As we are all aware that this is an unprecedented crisis and it presents unprecedented risks to the rights and safety and development of children. The major impact of COVID-19 is through the mitigation and containment measures to control its spread, including social distancing, movement restrictions, curfews, and border closures, which have driven a slowdown in economic and trade activity that has led to a sharp decline in household income and in some cases contributed to a spike in food prices, as well as remittance, which are quickly drying up, already down by as much as 50%. Household food access, especially in urban areas, will most likely decline in the near and medium term. Household food availability to late 2020 could also be affected if access to seeds and agricultural inputs become constrained. As far as the data we have currently, children have thankfully been largely spared from the direct health effects of the COVID-19. However, the crisis is having a profound effect on their well-being. All children of all ages and in all countries are being affected, in particular by the socio-economic impacts, and in some cases by mitigating the measures that may inadvertently do more harm than good. Children in Somalia and Somaliland continue to bear the biggest burden with soaring malnutrition rates, increased displacements, and child protection concerns, as well as missing out on schooling, among others. Due to the mitigation and containment measures we have above talked, including control to control the spread of this pandemic, leave children entirely reliant on their caregivers for nurturing, care, and to meet their physical, emotional, social, and cognitive development needs. With caregivers under stress for myriad of reasons, leaves children more vulnerable to toxic stress, violence, exploitation, and abuse. As data indicates, Somalia and Somaliland has about 4.5 million school-aged children. However, of these, only 35% of girls and 41% of boys are enrolled in school, which means about 33 million school-aged children were already out of school due to many factors, including humanitarian emergencies. This is prior to the COVID-19, but in addition, COVID-19 crisis already disrupting the education of millions of children due to school closures. According to the statistics from the field, only 16% of children are undertaking online learning from school closure to mitigate the spread of the COVID-19. And we are also aware the quality of the online learning in terms of internet quality, teaching methodologies, and so forth that affected the impact of education. This has eroded the gains that have been made over the years to ensure Somali children receive education without interruption. The school closures have also negatively affected girls through reinforcing norms and practice of gender inequality. The girls now shoulder the burden of taking care of the households. Girls are also more at risk to harmful practices like FGM and early marriages, as well as a higher likelihood for a terminal dropout of the education system. This is supported by the evidence gathered by Save the Children local implementing partners, from the communities and leaders. Because of the lockdown, young adults find time for each other as they are no longer occupied with work or school, which led to more couples getting married and running off with each other. Regarding TBV, including rape and domestic intimate partner violence in communities, there has been a spike in the number of cases of TBV in the last couple of months, as indicated by the report collected by the partners from the youth. This happened as a result of unemployment and lack of income. Because of low income, families are often living in a small spaces and can cause disagreement within the family, which consequently aggravates the situation. In addition, Somalia Child Protection Area of Responsibilities and local civil society undertook a small survey in April with 34 child protection agencies in Somalia who monitor reporting of child abuse cases. The report the partners and civil society collected from the field indicates that more than half of the child protection agencies have reported an increase in physical violence abuse as a result of caregivers and other adult family members becoming increasingly distrusted and applying maladaptive coping mechanisms. Physical punishment is on the rise, but 1% of children out of school are on the streets, missing out on education with increased vulnerability to conflict, sexual and economic exploitation. 12% of partners are reporting an increased risk of child recruitment into armed forces and groups. We also cannot underestimate the psychological distress the COVID-19 outbreak places on children. Partners are witnessing increased fear and anxiety among children as their daily routines are disrupted. Even before the COVID-19 outbreak in Somalia, boys and girls were at risk to all forms of exploitation. Now the risks are higher. The worst actually is that persons with disabilities, including children with disabilities, who face increased risks of infection and complications during the COVID-19 pandemic due to their underlying health conditions and socioeconomic inequalities, including poor access to healthcare, wash, and lack of access to public health and COVID-19 information researching. This is also making more challenging that CP services have been critically disrupted. COVID-19 mitigation measures have reduced access to critical child protection services. The data is indicating that only 5% of case management and 7% of psychological support, psychosocial support services have been adapted to provide remote support for children confined to homes. As consequences, significant numbers of children in need of case management services have been left out of protection referrals, counseling, follow-up, or support plans. This is actually very challenging, and we must make sure necessary life-saving GPU and protection interventions are scaled up as the crisis deepens. We need also to prioritize the continuity of child-centered services with a particular focus on equality of access, particularly in relation to schooling, nutrition programs, and community child protection programs.
Yeah. Actually, sorry, you have 1 more minute. 1 minute.
I will just conclude and thank the participants. I will come back with the questions and answers, but I will leave to the other panelists to also provide the sessions they have prepared. Thank you very much.
Thank you, Akli. I think that really gives us a comprehensive information on the status of the children affected by COVID-19. Thank you very much. Now it's my pleasure to welcome Sylvia to talk about the impact of COVID-19 on women and girls. I'll try to unmute Sylvia. Kindly keep time on 7 minutes. 7 minutes. Yes, you're able to speak.
Yes, yeah, you can hear me now, right?
Yep.
Okay, so I'll try. Good morning, everyone. Thank you for hosting, this event to Save the Children, and to everyone to join the conversation. So I think it will be important also to have time for reflection. So I'll try to be brief. As my colleague was saying, I'm going to focus on the impact of COVID-19 on girls. So to go straight to the situation, to set the scene, we know that impact of COVID-19 on all children, but especially for girls and young women have been particularly affected. So there's a suspension of education that heightens the risk of girls not returning to school due to economic hardship. So we've seen that in other contexts as well, like from our studies and research from Plan International. And in Somalia, there is also limited access to technology to ensure the continuous learning. So that can increase actually the risk of dropouts and not coming back to school. So the school's closure impacts beyond the direct loss of education, but also the loss of social contact, support of peers and teachers, and also like lack of opportunity to build networks that we know that creates that protective environment for girls and boys. And also we know also the lack of access to SRHR information that is provided within schools. As well, another area we want to mention is the loss of livelihoods. As like food prices also increases, families facing economic hardships can include also putting girls and young women into risky behaviors in order to put food on table for families. So it's something that we also have to pay attention as we have our discussion on way forward and measures. We know that being forced to be at home makes children more vulnerable to violence and abuse and make them witness to the domestic violence. So in Somalia, we have started to see also reports of domestic violence on the rise, and the protective umbrella of education and the care systems are no longer fully in place, so it can also have an impact on girls and women. Teenage pregnancies are also likely to increase as adolescent girls are sexually exploited and are forced to turn to risky strategies that we were mentioning before to feed families and themselves. And this has, all of this has clearly like an impact on the psychosocial effect on, on girls and young women. Not only for the short term, but also looking at long term. So that's also important that when we think about our responses as well, look at the medium and long term, like the recovery phases. So girls and women find themselves in some way more vulnerable, as they were also like carers of the sick. The isolation and further limits the access to vital health services, and more exposed to the virus, during the COVID-19 outbreak, as becoming the caregivers with the relatives, but also children. So what we, for these few minutes, what we wanted as Plan International, that has recently commenced operations in Somalia, focusing on child protection, education, and youth economic empowerment programming. We conducted an assessment on child protection and FGM. So we wanted to take this opportunity to share with you very preliminary findings on the impact of COVID-19, especially for girls and young women. We have a project that is working on strengthening child protection systems and creating a protective environment for children in Somaliland, especially for girls, in partnership with NAFI's network. But what we are going to present here is the key preliminary findings, and then after we can also share the final report. So the baseline assessment was conducted in the context of COVID-19 that has significantly impacted some of the indicators that we were looking at. So what we have looked at is also the impact on the lives of girls and boys, the strategies, how has impacted the prevalence on FGM, but also the information and the services available. We did mixed methods of quantitative and qualitative, so also like household surveys, but also focus group discussions and key informal interviews, complemented by desk review. And then we have almost like 900 people participated, and half of them in children. So going into the findings, And this will have to be refined, but just to give like all the audience like a quick overview, we've seen like increased levels of violence at the family reported by adults, by 57% of adults, and also by children, including physical and humanitarian punishment, domestic violence at the family level, also violence among siblings, sexual violence against girls by adults, and increase of cases of FGM. In terms of the prevalence rate of FGM, that was estimated before 97, 98 in Hargeisa and 40-50% in Burao. But we have seen that being out of school, it was a perfect timing for girls' circumcision, accounting for 61% of adults, and also the child responded. So it was also an opportunity to increase income levels for those perpetrating like circumcised. Children most affected in terms of groups, we've seen like IDP children living in the streets, adolescent girls, and also school-going children. In terms of key protection risks for facing girls and women, we've seen sexual violence, domestic workload, FGM, and child early and forced marriages. And the limited access to basic services are also noted during assessment. As much as like some of the services still available, the agencies have been fully, some of them fully and some partially affected, scaling down their services, which has also affected the access to services for girls and young women.
Yeah. Sylvia, you have 1 minute.
All right. And then maybe just then to finish, there's also like increased exposure to conflicts and sexual economic exploitation because of the school's closure and not staying at home. Some girls as well. And we have seen some of the actions identified by respondents during assessment that could include child-friendly campaigns, include like sensitization of caregivers and communities, and equipping girls with life skills on self-protection and online education programs. Maybe I'll leave it here, and we can engage more in the discussion on the way forward afterwards. Yeah. Thank you very much.
Yeah. Thank you so much, Sylvia. That was really helpful to understand the situation of women and girls across the country, and Somalia, both countries, Somalia and Somalia. So now I would like to invite our last panelist, Abdulkadir Daqane, a director from Source Children's Village. Daqane will help us understand the situation of children without parental care or unaccompanied children, and how COVID-19 has impacted them, and what is Source is actually doing about it. So welcome, Daqane.
Thank you, Ayan, and thanks to Save the Children and the communications and advocacy team for organizing this. This is really very helpful. We should be doing more often, to discuss about the impact of such crisis whenever it presents itself in the world. I am here in SOS National Country Office in Mogadishu. I am accompanied by 3 children who are also attending this webinar. This is Salma, and she's with us, and we have Hawa and Mohammed also is here. Thank you. I would like to just explain a little bit more about the impact. I think the other panelists have already discussed a lot on how this has affected children, all children. And you can imagine all the rights, most of the rights that are really impacted by COVID-19 is the first one, the right to health, the right to participation, the right to protection, the right to food. All these rights that are enshrined in the UN Convention on the Rights of the Child has been impacted. For example, when we talk about the right to health, we're talking about Somalia with a very poor infrastructure in terms of health And you can imagine we have only 16 health isolation space for the COVID-19. Then children who are living in this, the normal children who have their families with them are at huge risk. Can you imagine children who are unaccompanied? We have street children in Mogadishu. We have several institutional cares. We have orphanages that are established in the country. I was also aware that at the beginning, at the onset of the COVID-19 crisis, the government trying to also do an effort, collected children from the streets using whatever means necessary, and they were being put in a care center, in an institution. And you can imagine, I visited that institution in Hamarwene and in Mogadishu. There were more than 150 children in a very small, congested area. So as a child protection actor, we should be looking at this. The right to food. You can imagine children who are unaccompanied and who are living in institutions.
My apology, can you speak a bit louder?
Am I not being heard clearly?
Yeah.
Sorry.
Yeah.
I think my computer. So sorry to say, sorry if I was not clear at the beginning, but children who are unaccompanied and separated, they do not have easy access to food, and this will cause malnutrition for the children and also for any other caretaker who was there. And this will make them very vulnerable for the COVID-19 if you are weak in terms of nutrition and all that. Then we have the right to protection. This has become extremely challenging. So what we really need to do as an actors, as a child protection actors, is to be on top of the game and make sure we support and all our resources are channeled through the government. And we encourage the government to prioritize actions that ensure children, especially those who are pregnant, lactating women, and older women who are malnourished, alongside the critical health interventions that are existing, they should be the top target for the government. When it comes to the institutional cares, there are orphanages who are in the country, several of them. Unfortunately, the deinstitutionalization agenda does not work in this country and in most of the Islamic contexts. So we need to be mobilizing the government and making sure the scale up of interventions is there. We need to be up in the front line. Now, SOS, what we are trying to do, there is no enough data on children who have lost parental care, children who are at risk of losing parental care. We are planning to work with the protection actors and start an assessment in Mogadishu, identify all these children, identify all their key needs, the basic rights that they are lacking, and also come together as a group and harmonize our action. When this crisis, whenever we have such crisis, coordination is very key. We have the child protection area of responsibility who is doing a marvelous job of putting together all the resources. There is a new case management guidelines that was developed for Somalia. There is a message that was designed for children. So we need to be using these available resources. Coordination is very essential. Even at global level, we have the technical notes on case management developed by the Child Protection Area, Child Protection Alliance for Humanitarian Action. We have the new CPMS revision. We need to be coming together. I have seen someone present in the chat box also asked about the presentation. We will be continuing. This is the first session. We will have presentations, we will have videos, we will have questions and answers. Unfortunately, I have not seen a question on the chat box yet for the panel. So for children who are unaccompanied, even visited the IDP camps, those who have nothing to care for. It is really challenging. SOS is now running a family-like based care in Mogadishu. We have 120 children who have no one to care for. It is extremely challenging to provide even the UN guidelines on alternative care. Leave those who are living on the streets. Most of they are extremely exposed to all the risks and they are mainly vulnerable. I think that is my 5 minutes. And I'm not sure if I was clear for everyone. Thank you.
Yeah. Thank you so much, Dakan. I think that was really helpful for us to understand the situation of children without parental care. And we know how it's extremely difficult for these children who are without parents to cope in these difficult times. Now, straight to the panel discussion. I kindly ask you, and I repeat, I ask you to put all your questions in the chat box. I know we have a lot of civil society organizations, international partners, UN, and everybody, youth activists and child rights activists and experts as well in this Zoom meeting. Kindly put all your questions in the chat box so we all benefit from it and we all understand what can we do better to make sure these children are cared for in these difficult times. I will not take much long. So I will go to the panel discussion. So my first question is, as Sylvia was telling us more about how GBV or gender-based violence, FGM, child marriage has increased in this crisis or the pandemic. Sylvia, I want to ask you the first question as a moderator. Why do you think this is, increasing, and what can we do to address it now and also in the future across Somalia and Somaliland? Sylvia, welcome. I will ask her to unmute herself because I mute her. You can speak now.
Okay, thank you. I think you asked for what can we do, right, to during COVID-19 and after to respond to FGM. Yeah.
Gender-based violence in general.
Yes. Yes. So we have, as I was mentioned before, we have seen that there were already high levels of FGM, that the prevalence was already high in Somalia, and also the sexual gender-based violence. But it has been exacerbated as well because of the impact of COVID-19, because of the schools closure, because of the economic turndown. So the cases of FGM with information that we have from our partner, also from the preliminary findings from our assessment, we have seen that is already increasing. So we are already working with partner on the child protection system strengthening project that is looking at increasing the protective environment. We think that that's the approach that we should all coordinate and work together, increasing the protective environment, adapting services that are deemed essential in the context of COVID-19, seeing how some of the services can be adapted to ensure that girls continue to receive access to these services, but also looking at the medium and recovery phases. And I think the approach or model that we usually is like a way to holistically address a complex issue like FGM and sexual gender-based violence, including like child marriages, for example, is to have interventions that are looking at girls and boys, including like participation, ensuring they're listened to, their needs are at the center, but also having like interventions at family level. So ensuring that families, for example, receive like material like cash, multi-purpose, that don't have to, engage into like risk behavior, girls into risky behavior, so don't have like negative coping mechanisms. Also looking at like communities, for example, like awareness raising, ensuring like a community level like approaches, ensuring the solutions come from communities, strengthening the existing networks as well for identification and reporting. So we think that intervention at different levels of the socio-ecological model are very important, and as well to work with all the different stakeholders to ensure we also have like a legal framework and like a strong legal framework that can can protect girls and young women. And then maybe just to finalize, I think it's quite crucial in the context of COVID-19, but also in Somalia to address social norms. And I think for that, we think we can collaborate and work more together on how to address some of the social norms that are actually reinforcing and stopping us from making more progress.
Thank you so much, Sylvia. Before we go to the second question, I would like to, for the sake of the time, I would like to invite the children themselves to speak to us about the fears and the worries and the concerns they have. And we know that the children are invisible in this pandemic, and even though they are not the primary victims of this, but when you look at the context of Somaliland and Somalia, their life is already difficult, affected by the droughts, poverty, so many socioeconomic issues, health crisis, you know, lots of issues that's making the children of Somalia and Somaliland vulnerable to this pandemic than any other parts of the world. So I would like to hear from the children from Mogadishu to speak to us about what are the fears and worries about this pandemic and how it affects their lives. I hope Abdihana is with them and is able to explain my questions to them. The floor is yours. So we will have Selma, who is 17 years old, Mahmoud, who is 18 years old, and we'll have Hawalul, who is 13 years old. Any one of you can choose to speak fast. You will have 5 minutes to say whatever you would like to say and tell us how can we make sure that you are protected better, and we want to hear from you. What do you think? So Abdihana, welcome. Please help the children understand the question and also allow them to speak in Somali. Thank you. So I need to unmute. Yes, you are unmute. You are able to speak. If you are unable to speak, you can text the chat box. Takana, perhaps you can if they are with you.
Assalamu alaikum. My name is Salma Abdulsaq and I am from SOS Primary School. And I would like to talk about the effect of COVID-19 for the students. So COVID-19 has a great effect to all of us, especially as we are students. Some of these effects are that we are facing what's called low self-esteem. And by talking about this, it's something normal for all of us to wake up early and do our daily routine. But once lockdown comes away, it seems everything looks abnormal. Lockdown really makes us too lazy to read, too lazy to learn new things. So what we can say is that it's wastage of time. So we need to learn new things and different things. But this lockdown has a really great effect to all of us. But what makes us lose our confidence is that everything is going and is going on. The markets stay open, the hospitals also stay open, the hotels also stay open, but the schools are not. It's possible that some students lose their books because of this lockdown. So anaga lockdown ku kuna saameeyay waxyaabo fara badan. Maxaa yeelay dadka intooda badan waxay waayeen dhiiranaantii qabeen oo ardayda si ay u dhiiranayeen u dhiirano. Marka sidaas darteed taasoo lockdown-ka noo saameeyay waxaa laga yaabaa dadka qaarkood inay xiteen buugaagta ay waayeen. Maxaa yeelay Soomaalida inta badan ardayda si ay wax ma u barato kuwa aan waxbarashada jeclayn waxay u noqotay jaanis. Markasta waxay dhahayaan buugaagta waan weynay waynaga lumeen. I hope inaan imtixaanka la gelin national examination inaan la gelin. So ardayda oona awal wax baranaynin hadda waxay usii noqotay jaanis kale ee waxbarashada uga cararaan. Marka lockdown-ka saas wuu noo saameeyay ardayda oo hamigoodii oo yaraaday, self-esteem-kooda dhan wuu yaraaday, wax kasta way yaraadeen. So taasaa isdhahaya inay tahay waxa oo soo noo saameeyay lockdown-ka. COVID-19 effectigaas weyn uu noo geystay. Dad fara badan oo xiteen casharadii iyo xilmaamaa jiro oo examination-ka markii la galaayo oo yaabayaan oo isdhahayaan waxaan soo dhigan. Marka saasaa isdhahaya wuu noo saameeyay.
Waad mahadsan tahay Salma, aad baad mahadsan tahay. Hawalul soo dhawow.
magacaygu waxaa u salaad maxamed waxaan ku noolahay tuulada caruurta ee SOS waxaan matalayaa caruurta ku nool xarumaha daryeelka ee caruurta. COVID-19 wuxuu saameeyay isdhexgalkeena sababtoo ah COVID-19 wuxuu saameeyay isdhexgalkeena sababtoo ah anigii iyo saaxiibadeena xilliga hore waa wada ciyaari jirnay, waa wada kulmi jirnay, waxaa wada akhrisan jirnay, laakiin hadda waxaas dhan waa ay dhammaadeen. COVID-19 ka hor saaxiibada way imaan jireen way soo booqan jireen aniga sidoo kale aan booqan jiray waalidiintayda iyo walaalahey sidoo kale way soo booqan jireen aniga markay waxbarashada ii dhammaatay iskuulada dugsiga lii xiro waan booqan jiray laakiin hadda waxaas dhan ma booqan iyakana ima soo booqan dhinaca iskuulka waxaa jiro caqabadooyin badan aniga saaxiibada waxaan diyaarsanay jadwal inaan maalin kasta isbuuc kasta hal maad aqrisano oo aqrino isweydiino su-aalo waxay dhibaan macalinku weydiino laakiin waxaas dhan waa in laga baaqdeen aniga saaxiibada markasta waxaan ka qayb qaadan jirnay tartan iyo barnaamijyo tartan aqooneed tartan qur-aan iyo barnaamij taabuur ama sambirsa u taqaano laakiin waxaas dhan kama qayb qaadan COVID-19 awgiisa
aad iyo aad baad u mahadsan tahay
السلام عليكم أنا magacayga maxamuud cali nuur sahal aan leedahay waxa ardayda oo magaalada muqdisho wax ka barata oo hadda imtixaanka international galay rabto oo dowladda waxa arday dhigta fasalka fofor COVID-19 horta siyaabo badan oo dalka iyo ardayda uu noo saameeyay hadda midda oo ardayda oo aniga hadaan ahay fasalka fofor markaas waxaa jira imtixaanka oo ka dhiman oo beriya ka dhiman oo filitar imtixaanka and then imtixaanka ugu filitarna waxaa la ogaatiin iska qaato xaafidin aad ilaa amar dambe waa dareemi kartaa marka uu dhaho waqti xaafadaha tag lunaha wixii ay markaas ku haminaysid oo markaas asmiir taxta hoose u dhacay midda xigto oo dalka sida u saameeyay waxay tahay sheeg haddaa baxdid maanta oo magaalada aadid dadkii dhan oo magaaladii sidii awal intoosan cudurka bilaaban ka hor si isku socdeen ee haddana isku socdaan suuqyada sidoo kale gawaariyada sidoo kale dadka caadi u adeeganayaan oo ma muujin inuu badal jiro hadda ayaan hor dowladdu waxay bilaawday in lockdown sameysto lockdown wuxuu bilaabanayay ilaa habeenkii 2 saac kadib uu bilaabanayay waa ogtiin aniga magaalada muqdisho inkastoo dunida waxay aan ka dambeeyno xogaa ka dambeeyno dadka magaalada dumaadka jiro badan habeenadii wax gataa aniga laakiin dadkii wuxuu badin dad maalintii wax gato haddii la dhaho habeenkii kadib lockdown la sameynaa 2 saac kadib dad oo xarxaroodo waa maalintii sidii u soconayo marka dadkii sidii isku dhex socdaan iyo wixii sidii loo adeeganayaan ilaa hadda waxa aan fahmaa waxay tahay waxa oo midda oo wax kaliya oo waxbarashada hadda loo geliyo dadkii sidii isku socdaan oo dadkii awalba si ahaayeen oo hadda ilaa hadda sidii ay yihiin laakiin waxa kaliya fahmaa waxay tahay midda kaliya in waxbarashada hadda sidii loo geliyo
aad iyo aad baad u mahadsantihiin so thank you so much Daqane. Would you have 1 or 2 minutes to translate to us what the children just said?
Basically, thank you, Salma, Halima. I think Salma was speaking English, yes. And Hawa and Mohammed was speaking Somali. Basically, they mentioned 3 things. The first one was the closure of the school actually impacted on them and gave them low morale of study. Someone like Salma, who is highly motivated to learn and she has great plans, she cannot. She's lacking the morale and the motivation to learn, because when you're staying at home, it looks like holidays for all school children. That was the first one. And for Hawa, who is also living in alternative care setting, they used to have a program, a very busy schedule before. One was they used to have outing program with other children. They used to integrate with the community, children from the community, which they don't get much of the chance. Now, because of the corona crisis, the organizations are taking measures and the alternative care settings are in lockdown. So nobody can come in and nobody can go out. So that means the social integration element is no longer there for children who are living in alternative care settings. For Mohammed, he was really wondering, and he mentioned all the restaurants are open. This is a public gathering. The government tried to close the mosques. It did not work. now there's a plan of reopening the flights. So he's really saying, I wonder why was only the schools closed, not the restaurants, not the others. But he has a question. That was his question. But and then that's all in summary. Thank you.
Thank you so much, Daqane. That's really moving message from the children themselves, so we can hear what they have to say. It's really important that we listen to them because this is directly affecting their lives. Their opinions and what they say is more important. So before I leave Daqane, I would like to ask you another question about policy perspective. We know in the regional instrument, the African Charter on the Welfare of the Child, it states that Article 19 states that every child shall be able to entitled to enjoy parental care and protection and shall, whenever possible, have the right to reside with his or her parents. So, Daqane, you can hear me well, right?
Yes.
Yeah, so to underscore this, the need for every child to grow a family environment in atmosphere of happiness, love, and understanding. How does the spread of COVID-19 changes that? We know that this is really important and it's a right for children to enjoy, but how do you think COVID-19 has changed this?
Absolutely. You know, the most difficult thing is when you're doing alternative care, when you're providing alternative care for children who have no one to care for, you have to consider all the elements, the love, the affection, the caring, the attachment, and the social inclusion, the community integration. You have to consider everything because one organization or one family cannot simply provide alternative care. So when it comes to those, I can take a very good example for SOS and the alternative care we are providing for children. We used to have very busy programs like the last Eid festival. The village in Somalia used to be like extremely busy. All community members used to come, children used to go outing, but all of that has been affected. Again, coming to the family, those who are poor, who are economically, not in a good state, maybe living in grade 1 or basically grade 1, they will not be able to provide for their families. They will not be able to consider and care about the children. And usually at the state of emergencies, when such emergencies happen, people tend to panic. People tend to think about the bigger crisis. For example, the father who used to play very closely, or the care provider who used to play closely with the children under their care, will not be prioritizing that because of the stress they will face themselves. The parents need support before we support the children so that they will be able to support the children better. So the parents need a lot of psychosocial support. Those who are very poor will need a lot of economical and socio-economic support. We need to build a social protection system. This is like just a few days ago, I visited the village and one of the young boys was telling me, when am I going to play? When am I going to have fun? And imagine the grounds they have, the space they have, still they're not satisfied because they want the integration element. They need human beings, they need attachments, they need to integrate socially with the rest of the community. Thank you.
Okay, thank you so much, Daqane. So from now on, I'll try to, as we wrap up the next coming 10 minutes for this call, I would like to pick up some of the questions from the public. So Kamal from Hapayoko, an organization based in Hakisa, writes about how can we engage the community and parents and caregivers to reduce the effect of COVID-19, and how can we explain COVID-19 to our children? This question goes to Mohammed Aqli. Welcome. Aqli. Yeah.
Yes, thank you very much, Ayan. I think the question relates how we engage community and parents to reduce the effect of COVID-19 on children. I think we need to understand one thing, that the COVID-19 pandemic is a fast-changing situation, and access to communities can quickly become limited due to restrictive measures. So we want first communities to understand the situation, the risk of the disease, and how it impacts to children, their children. We also need to set up and mobilize community-based systems since a lot of travels have been restricted, and going to the field is also more challenging. So working with the community-based structures like champions, applying particularly the protective measures is make more impact to reach the communities. Messages should be tailored to the target communities and should be accessible to all different people. So I think these different approaches will probably bring on board communities and also contribute to the reduction of the effects of the COVID-19. Thank you.
Thank you so much. I'll try to pick up another question from the chat box. So Abdurrahman Abdullahi writes, how can rights of the children be ensured during the COVID-19 and reduce home violence during this period? So I will give this question to Sylvia. Sylvia, I'll ask you to unmute. You are on.
Yeah.
Go ahead.
Can you please repeat the question? Sorry, I didn't get it right.
Yeah, so Abdurrahman writes, how can the rights of the children be ensured or to be protected during COVID-19, and how can we reduce the home violence in these lockdown times?
Thank you for the question. So it's not, you know, as you can imagine, it's not like a single answer, but some of the things that we have been wanting to do is to continue ensuring the services continue, essential services. So to ensure like we map the existing services and are able to continue identifying. So it's very important, the identification for the reporting. As well as the provision of information on where to report. So there's like been, for example, like helplines, looking at like how can children be informed where to report. So first of all, like for children to have the information where to go. Also for other community networks to identify when, what are the signs, and those that are still in contact with the community, like the health workers, or if there's, you know, because now children are going to school, they're able to identify those signs and report. Also to look at, like, for example, parenting, there's like high levels of stress, how we can continue support to these parents and caregivers to reduce levels of stress that can also reduce the levels of violence at home. So there's not like a single one approach, but there's different ways to adapt the work that we usually do with child protection in the context of COVID-19. And maybe if you are interested in to dig deeper in one of the interventions, we can also share further information.
Thank you so much, Sylvia. So before we wrap up this call, I will not be picking up any questions from the chat box. Unfortunately, there are too many and we don't have a time to finish. What is one or two recommendations that you are leaving here in this call and that we need to be doing for the women and girls impacted by COVID-19? I will ask you the same questions to other panelists, but you go first.
Thank you very much for the opportunity. So there's many things that we have to do, but also we have to join efforts and coordinate and work together for sure. So this is like an initial, like, you know, good opportunity to be on this call together. So I want to highlight that we need to include measures to address gender-based violence and child protection in all COVID-19 response and recovery plans. So every recovery plan or response that looks at health crisis response has to include gender-based violence and child protection and ensure that the plans are gender and age responsive. So that means that we understand how different groups, how girls, how adolescents, how children are differently impacted and are considered. Also, we need to prioritize the services, preventing and responding to violence, and that are deemed essential services. So we cannot, we cannot think that because of schools are closed, education is not essential, or because of like social workers are not able to go to the community, that the social work is not essential. So we need to ensure that the essential services continue. So that might include like, ensuring the funding at all different stages, helplines, case management, like psychosocial support in remotely, for example, but that has to be prioritized and considered essential. And maybe my last one will be to ensure that it's adapted. So for all stakeholders, governments, but also ourselves like NGOs and community-based, we need to adapt and be flexible to ensure the girls, like and young women and all children access during COVID-19, access services, in a remote manner, or directly through community-led forms, but I have to continue.
Thank you so much, Sylvia. The same question goes to Abdikatif Dakane. Dakane, welcome.
Thank you. I think when this kind of crisis come, Sylvia also put it well, we need to come together as one. We need to coordinate together and go together as one entity, as a child focus. And remember, when it comes to the rights of the children and the protection of the children, the ultimate responsibility is the government. So we need to be proactively coming together, working with the government, and to push for, the rights of the children are protected. And my one message, if I will have to leave one message here, is children who are living in alternative care settings in Mogadishu are extremely at risk. Those who are living in orphanage centers, they are definitely at risk. And I don't have the evidence now, but I will really like the government to visit, which we will share the evidence very soon. Thank you.
Yeah. Thank you so much, Abdulqadir. Lastly, I will give this opportunity to Mohammed Aqli, and then the next 1 minute we will wrap after Aqli. Aqli, welcome aboard.
Thank you very much. I think they have did most of the summary and the wrap up. I'll just add that we need to make sure that we reach children with disabilities. They are the one left out in all messages and all support, and all agencies need actually to pay a lot of effort to reach those children. They have experienced a lot of barriers, and they have been left out in all plans. So I think it's important that we always keep in mind and pay a lot of effort to reach those children with disabilities. Thank you.
Thank you so much, Aqli. Thank you so much, Sylvia and Abdulqadir Dakane and our amazing children. It's really been amazing to host you in this meeting. We intended this meeting so we can bring the public eyes on the rise of the children affected by COVID-19. I would like to remind you that we will be having these kind of meetings every 2 weeks. Will be hosted by Save the Children, and we will speak about different topics, including education, how education is impacted, how specifically girls have impacted on different kinds of, overall the rise of the children in Somalia. I would like to thank you everyone for attending this call. It's been a pleasure having you all. And until our next meeting, I would like to leave you goodbye, and thank you so much.
Thank you, Ayan. Thank you, the rest of the panelists, and thank you everyone for joining us.
Thank you. Bye.
Ciao.